Hi, my name is Penny Eshelman, and today I'm going to talk about Fragile X syndrome and how it impacts education and the different support systems that we can use. So, what is Fragile X syndrome? It is the most common hereditary intellectual disorder, and it is the second leading cause of intellectual disability, followed by Down syndrome. And is also known as Martin-Bell syndrome, and it is caused by a mutation on the X chromosome. And it affects 1 in 7,000 males and 1 in 11,000 females. So why does it affect boys more than it does girls? Since girls have two X chromosomes, when one of their chromosomes is affected, they kind of have another one to fall back on, where boys have an X and a Y chromosome, so when their X chromosome is affected, their symptoms are kind of like more severe. So that's why boys usually get more diagnosed when they were younger, because the symptoms show up a little bit earlier. So the early diagnosis for boys is between 35 and 37 months, where females are around 42 months. So key characteristics of Fragile X syndrome include cognitive learning disabilities, such as low intelligence and delayed milestones. They can also be nonverbal, and they might have challenges with language processing. Now, this can look different between boys and girls, where boys have a higher level academically and motor planning, where girls have a more difficulty with abstract thinking and behavioral outburst. Behaviorals can also look like ADHD. They might get social anxiety, and they might demonstrate this through like hand flapping, poor eye contact, and they do have sensory sensitivity. Also with difficulty understanding social cues. Physical, there are a lot of physical characteristics of this disorder, including a long, narrow face, large forehead, large ears, cross-eyed and low muscle tone or flexibility joints. And they also have social emotional difficulties with anxiety, depression, and maybe even obsessive compulsive disorder. So this is kind of what a student might look like. You can see how there's large ears, and if you look over to the right, you can see the difference between the two chromosomes. One is normal and one is fragile, and you can kind of see the mutation at the bottom. All right, we'll move on. And Fragile X syndrome in the context of special education, it is a low incidence disability requiring a lot of support, and it affects multiple areas that we kind of already discussed, cognitive, behavioral, sensory, social, and communication. Students who have this may apply for an IEP with ages from 3 to 21, and if they're under 3, they can qualify for an individual family support program. We really want to emphasize on individualized instruction and a multidisciplinary approach. So when you look at your classroom, you want to make sure that it is calm and quiet, with allowing rest breaks in between, due to these students do get a lot of anxiety. You also want to look at seat placement. You don't want a high traffic area, or even look at like where they are, like if they're by event, because they do get overstimulated. And they do very well with visual schedules to kind of help with transition, to help with that anxiety. Instructional strategies include assessment adaptations, where you can kind of use like a fill-in or an oral to kind of check their executive function. You also want to allow these students to have an extended time to process what you're asking and have a closure at the end of the activity, which is kind of like a summarization of what you are teaching. They also benefit from backward chaining, where you start with the last step and you work your way forward. Also, we already talked about a multi-sensory approach. They do well with manipulatives. You can see a picture on the right. There's different math manipulatives that these students can use. Auditory, where they are listening to a story and then trying to read it. And then also a lot of visuals, like over to the picture on the left. You could also use curriculum differentiation for these students to make sure it's an individual learning program by breaking the task into smaller steps and using visual aid. You also want to make sure that you are simplifying the language. You can allow for oral responsive visual projects or assistive technology. So you can use assistive technology and support for these students, such as AAC devices, which is argumentative and alternative communication devices. And these are devices that might have like pictures or a sound that can help these students to kind of communicate. And they have like picture exchange systems. You can also use sign language for these students. You also want to look at adaptive tools since they do have fine motor disability and low tone, and you can do this with like different keyboards, touch screens, or alternative mouses. You could also use visual support. You can kind of color code it, use charts or even timers, and even look at postural support for these students due to the low tone. These can include like wedges or just any specialized seating. And you want to make sure that you're using supportive services. You can work closely with occupational therapy, and they will work with these students on providing like a sensory diet. Also, they can work on like fine motor and hand strengthening, and even come into your classroom to look at different like seatings that they might need to help support them. Physical therapy will work with like low tone with strengthening their lower extremities, and they can even work on their posture for sitting. And the speech language pathology, you would work closely with developing if they would need like a communication device. Regular team meetings is very important because you want to make sure that everybody is working together and that it is getting carried over to promote independence and emotional growth for these students. This is all possible due to federal laws. You have the IDEA, and it incorporates free, appropriate public education in the least restricted environment. You can also go through a Section 504, which ensures equal access and accommodations. And the ADA prohibits discrimination that ensures accessibility for these students. And it is our ethical duty as teachers that we are showing respect and independence for every student. Current educational practices, we want to make sure as educators that we are continuing to grow our professional development for these students and providing specialized education through like co-teaching aids and specialized instruction. There is a challenge due to the lack of resources and staff training. So we want to make sure that we are continuing to grow as educators. So in conclusion, Fragile X is a complex lifelong condition require individualized education with collaboration among families, educators, and therapists is very important. And federal law protects these students from getting the best possible education with adaptations that might be needed. And teachers play a vital role in promoting inclusion and independence.